The federal government took its first legislative step today to implement changes to the capital gains tax. It introduced a motion that was first announced in the budget.
Many of the wealthiest Canadians make most of their money through investments, not income. But because of how investment gains are taxed, well-off Canadians can wind up paying a lower marginal tax rate than a nurse or a plumber. That's not fairness. That's favoritism. And so, beginning on June 25th, well-off Canadians will pay tax on 2/3 of their capital gains instead of just 1/2.
The motion today forces Conservatives to vote on the rate increase separate from the rest of the budget. A vote is expected later in the week. Well, the changes have prompted the organization representing doctors to speak out. The Canadian Medical Association says that this will put access to health care at risk. Dr. Joss Reimer is the president of the organization, and she joins us tonight from Chicago. Doctor, thanks for being here. The CMA says this decision by Ottawa puts access to health care at risk. Why is that?
You know, in the quote that we just heard from the Deputy Prime Minister, she's talking about the wealthiest Canadians. But the difference that we're seeing when we're thinking about physicians is that unlike for personal taxes, we get applied under the corporate tax, which means there's no $250,000 exemption. We're going to be facing an increase in taxes on any of the capital gains that are happening in our income because of the way our system is structured. And the current way it's structured is that most physicians in Canada function through corporations. But the corporations are really, you know, for example, my corporation, it's just me. There's no shareholders, there's nobody else making money. And so me as an individual saving for retirement, saving for sick leave or maternity leave, I'm going to be facing an increase in my taxes as I try to save for those things because doctors don't have access to pension or sick days or maternity leave or parental leave.
Yeah, I want to get into some of the criticism and the pushback for the CMA in a moment, but what have you been hearing from your doctors about how this capital gains tax hike is proceeding and how it will affect them? You know,
we're hearing a few different things. The one is physicians think that physicians should have to pay taxes and we want to pay our fair share. But we hear a lot of worry, especially from family physicians, where they're already struggling. There's so much stress on family physicians working in the communities, trying to run practices where they have to rent or own the building, they have to hire the staff who work there, they hire the cleaning staff, the people who do the finances. And so when they're thinking about one additional stressor on top of everything else that's going on, there's a lot of people who are sort of thinking, you know, is this worth it? Or should I maybe be thinking about retiring early or looking to move some of my practice into a different type of medicine where it'd be more lucrative or I wouldn't have to worry about all of these out-of-pocket things. And so anything that's making things harder for family physicians is really concerning to me because we know that over 6 million Canadians already don't have access to a primary care provider.
Okay, so let's talk now about some of the pushback to exactly what you're saying here. A recent column by Dr. Danielle Raza in the Toronto Star, it said that the capital gains tax is only really going to affect Canadians with an average income of $1.4 million. And according to Canadian Institute of Health Information, the average earning for doctors range from $299,000 to $507,000. So how many doctors will really be impacted by this, and will all doctors be impacted uniformly?
So most doctors will be impacted by this because we're taxed under the corporate side. And so under the personal side, you get an exemption for the first $250,000 of capital gains. And that's where it is fair to talk about, you know, this is more affecting the wealthiest Canadians. But because of the way our system is structured and the fact that doctors put their money through medical corporations, we don't get that exemption. We're also not eligible for small business tax exemptions. So it means that there's really no option other than paying those additional taxes. And that's why physicians are uniquely going to be affected in a greater way than most other Canadians, regardless of whether or not we're making anywhere near those numbers that are being quoted in some of those studies. And that's what's really concerning is we don't want to discourage physicians from providing care to Canadians who deserve that care.
This doctor goes on to say the opposition to this and these tax changes by your organization is a blunt one. It potentially is tone deaf not only to some of their own members, but to Canadians, in particular to those having difficulty making ends meet. Do you see how some could see it that way?
Well, anytime you're talking about taxes, it's really tricky. And we care a lot about making sure that Canadians have access to everything that they need to be healthy. And that means we're thinking about things like health equity, food security, income. And so, anytime we're talking about this, those are really tricky. And we're not saying that physicians shouldn't have to pay their fair share of taxes. They absolutely should. But when somebody's trying to decide whether or not they're going to be able to keep running their family practice, first off, the family docs are on the lower end of the scale for the income of physicians across the country. But on top of that, they pay so much out of pocket. They pay up to 40% of their income goes towards running their practice. So when we're talking about the wealthiest Canadians, that's really not who we're talking about, but it's still who will be affected.
I'm out of time here, but I do want to ask you one quick last question. What changes would you like to have seen instead?
We would have loved to see an exemption for medical corporations because they already aren't eligible for the small tax or the small business exemptions. But in the absence of that, then we would like to be able to be included in that $250,000 exemption that personal capital gains get. Because like I said, most of our corporations, they function like personal savings, and we're just trying to save for our own wellness, our own retirement, our own paternity leaves. And so if we can treat it like that with the $250,000 exemption, that would be a pretty good second option for us.
All right, Doctor, appreciate your time tonight. That is Dr. Josh Reimer, President of the Canadian Medical Association, joining us from Chicago.